Healthcare should be guaranteed as a human right. By the end of this speech, my audience will understand why healthcare should be seen as a basic human right, why the U.S. healthcare system fails millions of Americans, and why guaranteed healthcare would improve health and reduce costs. The federal government should guarantee free healthcare as a basic human right because the current healthcare system leaves millions of people without good and proper care. Healthcare is a human right, should be a human right, and it would improve health outcomes while lowering overall costs. Imagine waking up with hard chest pains but thinking not to go to the hospital because you know the medical bill can leave you in debt. For millions of Americans, this is not imaginary. It is a real thing that they face every day. During this speech, I will explain why healthcare should be guaranteed as a human right by the federal government. Healthcare affects many Americans regardless of income, age, or background. After researching organizations such as World Health Organization and Centers for Disease Control and Prevention, I have found evidence that healthcare saves lives and improves public health. Every person will eventually need medical care. Whether you are healthy or not, healthcare still impacts you, your family, and your future. First, I will explain the problems with the current healthcare system. Second, I will talk about why healthcare should be considered as a basic human right. Lastly, I will discuss how guaranteeing free healthcare would benefit many individuals, society, and the economy. To understand why change is a very much need, we first need to examine the problems in our current healthcare system. First, the current U.S. healthcare system leaves millions without affordable medical care. Healthcare costs prevents millions of Americans from getting the care they really need. Healthcare in the United States is one of the most expensive things in the world. Even people who had health insurance also face expensive copays and surprise medical bills. Because of this cost problem, people will not go to a doctor until their illness becomes worse. For example, someone who notices their early symptoms of diabetes may take a long time to see a doctor because they cannot afford a visit to the doctor. By the time they had received treatment, their disease may have gotten much more expensive to manage. According to the Kaiser Family Foundation, almost half of the U.S. adults have skipped medical care because of the cost. This shows that financial barriers prevent people from getting the health care they need. Delaying healthcare causes worse health outcomes. When people avoid regular doctor checkups, illnesses get often more serious. Medical conditions like high blood pressure and heart disease can often be treated better if they catch it early. This creates two major problems. First, patients get more sick than they would if they have gotten their earlier treatment. Second, treating advanced diseases is more expensive than preventing them. This means when healthcare is unaffordable, many people pay through higher healthcare costs and poorer public health. The U.S. spends almost the most on healthcare but gets poor results. Many people assume that spending money means getting better healthcare. America spends over $13,000 per person each year, yet they have shorter life expectancy, infant mortality rates, and more preventable deaths. According to the Commonwealth Fund, the United States ranks last among high-income countries in healthcare access and health outcomes. These problems show that our healthcare system is failing many Americans. But even beyond cost, there's also an important question. Should healthcare be considered a human right? Guaranteeing free healthcare would improve many lives and reduce costs. Healthcare would encourage preventive care. One of the biggest benefits of free healthcare is that people would be more likely to get treatment before their sickness or illness gets more serious. For example, regular screenings can detect cancer early. Vaccinations prevent dangerous diseases from spreading. Instead of waiting until they got seriously ill, people would receive routine care that keeps them healthy. Healthcare would lower overall healthcare spending. Many people think that free healthcare would be expensive. However, research suggests that the U.S. already spends a lot of money on healthcare but it actually spends it poorly. Hospitals spend big amounts of money on billing insurance companies and collecting unpaid medical bills. A study published in The Lancet found that a healthcare system could save many lives each year while reducing healthcare spending. Rather than spending money on hospital bills after someone gets very sick, the healthcare system would invest in prevention. Healthcare could also straighten the economy and improve quality of life. Healthier people are able to work better, attend school every day, and contribute to society more. Businesses would also benefit because their employers would spend less money providing health insurance for their workers. Families wouldn't have to fear financial ruin after an unexpected sickness or accident. Instead of worrying if they can afford treatment, Americans can focus on recovering and going back to their reproductive life. Healthcare benefits everyone, not only patients, but healthcare providers, taxpayers. When we look at the evidence, it becomes clear that guaranteeing healthcare is not responsible but practical for the economy. Today, we talked about the 3 important reasons why the federal government should guarantee free healthcare as a human right. First, America's system health right now leaves millions of people without access to medical care. Second, healthcare is seen as a human right that should not be dependent on one's income. Finally, healthcare would improve public health, reduce costs, and strengthen our economy. We do not want to imagine a country where a parent has to choose between paying for the rent or taking their child to the doctor. Imagine a society where everyone in the U.S. receives the medical care they need without fear of doubt. That future is possible if we see healthcare as a human right. It is time for the U.S. to make sure that no life is worth less because they cannot afford healthcare.